The New York Times today, which is one of the leaders in the hysteria movement, has another article about Houston. You know, the hospitals are just overflowing. So what do we live in two different worlds of perception? How do you explain this?
Well, I think you can make statistics say anything you want, right? So I think it depends on how you look at this. Following bigger pictures, it absolutely stands to reason that we're going to see an increase in number of quote-unquote positive cases as we do more testing, as society starts to open up a bit. But up to this point, the vast majority of fatalities and long-term hospitalizations has been in a population over 65. And now we start to see these areas of the country where they haven't really had much of a surge or peak before, and the natural progression of these respiratory illnesses or any illness will tend to work its way through society and civilizations and kind of find its way into different communities. And so, I read an article last week that of apocalyptic proportions in Houston, the hospitals are almost at capacity. And I can tell you, at least in the metropolitan area of St. Louis, we never even hit our best case scenario as far as overwhelming the system. The hospitals generally run from an ICU capacity. A lot of people really focus on the severity of the illness based on ICU capacity and admissions. They usually run about 80 to 85% capacity to begin with, and so they have that built-in surge factor there. The vast majority of folks that are in the ICUs are not COVID patients at this point. They're non-COVID related illnesses. So if you don't dive one step deeper into this to figure out, well, when you say that a hospital is at capacity or having to turn patients away, how many of those are positives for COVID and are related directly to COVID illnesses? And if you don't, then you're taking a headline that says lots of increased cases, and then next step is, hey, hospitals are overwhelmed, and draw the conclusion that those two things are directly related, and that's not always the case. So, of course, there's going to be some natural ebbs and flows in this, but following other trends like hospital admissions for this, days of length of stay in the hospital for the illness, ICU admissions, death rates, those numbers still look good nationwide, and then death rate continues to decline. Today, reporting lower numbers so far than the past week or so, and the rolling average continues to decline. So I think you have to focus in on those. And to your question, really, it's true. I think if you look at it with the view that you want there to be a bit of chaos out there, if you don't tell the whole story, it's easy to get overwhelmed.
Yes, hold on if you would, Doctor. FlattenTheFear.com. It's mind-opening, and it's doctors behind it.